Hello, Yellow Chair listeners. I'm Helen, the podcast producer for our show. As we ideate and craft a new season for y'all, we wanted to share a recent news appearance Soo Jin Lee, our director, did with Spectrum News about mental health challenges facing people of color. Soo Jin explores how this impacts therapy and healing for Asian and Black communities. And so in today's news segment, discover how cultural understanding can transform mental health support.
5 years after the COVID-19 pandemic began, we're still seeing the impacts of the global crisis on people of all ages, races, ethnicities, and cultures. According to the Centers for Disease Control and Prevention, the country is currently in a mental health crisis. The political divide and social unrest the country is going through right now are factors, according to recent surveys by the American Psychological Association. Close to half of U.S. adults say politics is a significant stressor, while some people seek professional help through a therapist to help them deal with mental health crises or issues. A large number of people of color experience some unique challenges and disparities when it comes to therapy. Joining me now is Soo Jin Lee, a licensed marriage and family therapist and the executive director of the Yellow Chair Collective. Thank you so much for joining me today.
Hi, thank you so much for having me today.
So, according to a report by the nonprofit KFF, among adults who received or tried to receive mental health care, Asian and Black adults are more likely to report difficulty finding a provider who they feel can really understand their cultural experiences compared to their white counterparts. Can you explain why that is?
Yeah. There's definitely multiple challenges when it comes to Asian and Black and other minority clients in comparison to white counterparts when receiving the mental health care services. One of the biggest barrier I would say is the cultural stigma. Mental health is still a huge taboo in many of our communities in American society, but specifically within the Asian as well as the Black communities. Seeking therapy can feel like we're, quote unquote, airing the dirty laundry or even failing family expectations or bringing shame upon the family. And so it feels that many of the folks are seeking help at the very last straw when symptoms are very severe. And there's also language barriers as well as some systematic things that are really getting in the way as well. So healthcare access and insurance being one of them, financial resources and underrepresentation within the mental health advocacy space is another one. And like I mentioned, language barrier being a lot of the immigrant communities would need to have some therapists that are either bilingual or multilingual in order for communication gap to happen within the services, and those seem to be a bit lacking.
And there are studies that show people of color and those in minority groups generally tend to do better in therapy when their therapist is of the same race or ethnicity. And as you mentioned, that seems to be the trend. Can you explain for people who might not understand the stigma of shaming the family or dishonoring, the family by airing their dirty laundry? Some people may not quite understand where that ethnic and racial sensibility comes from.
Yeah, absolutely. I myself identifying as Asian immigrant and working with a lot of those folks. We come from a culture where community and family is a primary source of our identity. And we live in a society where American culture really values individuality, right? And so there's that dual pull when it comes to that cultural element. And so one of the things for a therapy seeking sometimes that may not connect very well with some of the Asian folks is that when it comes to family dynamics, if there is miscommunications that are happening, a lot of the therapists are taught to tell their clients to set boundaries, right? But there's different ways in which that boundary can be set for certain Asian communities that may or may not be applicable for a white family.
With the recent ICE raids in Los Angeles, what have been the concerns among Latino and Asian populations, both documented and undocumented? And how can therapy help them at this time?
Yeah, of course, there is a huge sense of fear right now going on amongst Latinx and Asian American communities. And this fear is targeted for both undocumented but also documented immigrants as well. There is a lot of also mixed status within a lot of immigrant family households. And so there's a fear for themselves, but also amongst their family members that they might be deported. There's also a lot of distrust in the system as well that may be preventing them from getting the help that they need. There's a huge need for community care and community healing when it comes to the immigrant population and the minority groups that I work with a lot. And when we cannot gather as a community, that is taken away as a source of healing as well.
Community healing, so important. Soo Jin, I really appreciate your insight on this topic. Thanks for spending some time with me today.
Yeah, absolutely.